If you're experiencing hot flashes, night sweats, mental fog, urinary incontinence, or vaginal dryness, you need to optimize your hormone replacement therapy. In order to do that, you need some few simple steps. The first and most important step to optimize hormone replacement therapy is to find the perfect physician for you. The first step is looking for a board-certified physician. In my opinion, a gynecologist would be your first choice. Second, I would peruse their website, looking for a specific page that talks about menopausal health, or more importantly, looking to see if they're a member of either NAMS, North American Menopausal Society, or ISHWISH, the International Society for the Study of Women's Sexual Health. If you find your provider has board certified, is a member of one of these two organizations or both, you're just about halfway there. The final step is wondering and inquiring about how do they prescribe their hormone replacement therapy. If they tell you the best and only way to do this is by pellet therapy, you've got the wrong physician. You need a physician who can interchangeably use pellets, use bioidentical creams, or even use medications that are FDA approved and covered by your insurance. So I'm sure this information is helpful. If you would like more information, give us a call, email us, and I look forward to speaking with you.